One very important question is asked, why do we check vitamin B12 whenever a patient presents with stroke, numbness, tingling, or memory problem? So vitamin B12 is very important vitamin in our body, and it helps in making a sheet around our nerves, which is called myelin sheet. And it also lowers the level of homocysteine, which prevents in stroke and dementia. So it is very, very important to check vitamin B12 level, because if your level of vitamin B is low, it can cause early memory problems like dementia. It can cause stroke. It can even cause visual problems and affect the nerve which control our vision. And it can also cause neuropathy of the periphery, which we call as peripheral neuropathy. So we always make sure that your vitamin B12 level is okay. And early detection is very, very important, because sometimes it can cause irreversible damage. So we always recommend to check your vitamin B12 level.